The broadcast is now starting. All attendees are in listen-only mode.
This is Danny Bobrow, President of AIM Dental Marketing, welcoming you to this installment of the Practice Perfection web-based education series. Today's presentation is entitled, The New Patient Grid, How to Have New Patients Accept Your Best Care and Keep Them for a Lifetime. Peter S. Evans, MS, DDS, MAGD, is President of the BioCompatible Dentist, LLC, a company that provides education and resources for dentists about whole-body dentistry. He is a practitioner, author, speaker, national dental coach, and a founding member of the American Academy for Oral Systemic Health, which is where we met so many years ago. Dr. Evans' expertise lies in his ability to research and bring innovative solutions to the emerging evolution of dentistry to include whole-body care and thereby create patient value. As creator of the Natural Path to Dentistry for Whole Body Health, a multimedia educational resource for dentists, Dr. Evans has helped dental offices across the country and abroad increase their efficiency, patient care, productivity, and prosperity. The New Patient Grid replaces the old New Patient Exam taught in most dental schools. Success comes in learning first what your patient wants, then ethically influencing them to help them accept that care. I want to acknowledge and thank the Dental Herb Company for generously agreeing to underwrite today's program. Before we get to Peter's presentation, I want you to know that Practice Perfection webcasts run for around 90 minutes. While attendees are in listen-only mode, we invite you at any time to submit your questions or comments using the question button on your screen. We will allow time following the presentation to get your questions answered, and if for any reason we should not get to your question during the webcast, we will see that they're answered shortly thereafter. Attendance at this presentation entitles you to receive 1.5 hours of continuing education credit. Shortly following the webcast, you'll be emailed an evaluation form along with instructions on how to receive that CE. Participants are cautioned about the dangers of incorporating techniques and procedures into their practices if the course has not provided them with adequate clinical experience to allow them to perform it competently. And now, it is my pleasure to welcome back to the Practice Perfection stage my friend, Dr. Peter Evans. Hello, Peter.
Danny, how are you? It's a pleasure to be with everybody. Glad to have everybody here. And this is a couple of times we've talked on your webinar series, so I'm glad to be back again.
I'm glad to have you back, Peter.
Good. Well, then let me start by just kind of going through a couple of things that make sure that people know that why I do the kind of things I do. Got to dental school late myself. I did research at National Institutes of Health. I've got my master's degree in microbiology and immunology. Stopped 3 or 4 months short of my PhD research just to go to dental school. Let's see, I taught undergraduate bacteriology at Virginia Commonwealth University. I've got my mastership in the Academy of General Dentistry. I practice and I coach and I speak. As a matter of fact, just got back from Reno last week where we had the combined meetings for the IAOMT, the IABDM, and Dr. Joseph Mercola was speaking just before me at that meeting. Great meeting, and it's more about nutrition, health, whole body dentistry. He was there just to give his promotions for mercury-free dentists going on to be mercury-safe dentists, which is something that we believe in also. So tonight I want to talk about the new patient exam and what are we trying to accomplish in the new patient exam. We know 3 things. We know new patients are the lifeblood of the practice. We know that the average new patient value is the single most important metric for practice growth, bar none. And we also know that the more patients that say yes, the more growth we have. So that is the premise for the new patient examination. Now, the new patient exam is absolutely the most important appointment that you're ever going to have with your new patient. So what are we looking for? What are we trying to accomplish in this new patient exam? We have certain things that we kind of want to find out, just besides how many fillings and probings and things like that. But what would you like to know ahead of time about your new patient? What would make it easier for you to get your best dentistry off the shelf if you knew a secret? Now, so let's say if you had a bunch of Navy SEALs getting you information and intel on this new patient, what would they be looking for? What information is needed to complete that information? So wouldn't it be nice if you knew what the patient was interested ahead of time? And how would you figure that out? Why are they in the office to begin with? What does the new patient want in a relationship? What's going to get in the way of them accepting your best care, so you could head that off at the past? When do they want to start treatment? Knowing all of these things, wouldn't that give you intel and a better chance of the patient accepting your best option care? I mean, the patient would give you all this information, and it ultimately relates to them giving you permission to create a plan that they design with you and that they will accept more readily. That is the new patient grid. Now, the new patient exam is where we all started. Now, that gives you a new patient average value of about $1,500, $1,700, and that falls easily within any insurance plan, but that's about all it does. And I'll bet your new patient examination starts with some, initial rapport, and then you start taking the x-rays, you take some photographs, you pick up the Explorer, you do your charting, and you gather all of that clinical data for your diagnosis and your treatment plan, and that's sounds pretty normal to me, but we can stop right there, because there's something new I want to present for you tonight, and it is the entire process of the new patient, and we call it the new patient grid, because it just doesn't start nor end with the examination. So my son is a Marine, and when he looks at a situation, he says it's all about accomplishing the mission. He says if you don't go into a situation and not know the grid. So the grid is this. It's 10 elements to achieve the successful objective, and we call it the grid. So what we're trying to accomplish, where do you start? What are the goals for the patient, for the office, for the staff? What do we include in the plan? What end result are we looking for? There is a 5-step formula that brings the new patient grid to life. And it's the opportunity, the conversation, the discovery, the proposal, and the agreement. And it looks like this. You want to find out what your patient wants. You want to influence your patient in a positive way and in an ethical manner to help that patient perceive the need for your care, accept what you're saying, and move forward with your best option, biocompatible dentistry. So the execution and the administration of these 10 elements are like this. The opportunity has 3 basic elements. The conversation is basically one element, and that is introductions into your staff and conversations with the new patient. The discovery is examination, diagnosis, and treatment plan. The proposal is what we used to call case presentation, and I'm going to tell you a little bit about that tonight. And the agreement is the agreement you had with your new patient, financial arrangements, and the scheduling of treatment. So all those things are inside the new patient grid, and they are the 10 elements that comprise the new patient grid. Now, let me just go through them briefly so you can kind of get a feeling for where I'm going. The opportunity is lots of things. It's the only chance you're going to get to make a first impression. It's your signage, it's your phone skills, it's your office, it's the smell of your office, it's your attitude, it's your paperwork, it's your comfort, it's the sounds of your office. The conversation is a little bit different. This is where you communicate on the same level that your patient understands. And that's not easy to do. We talk dentalese so much. But, you know, when we make a decision, all of us make decisions by taking into account information from trusted sources, that it gets filtered through our subconscious. And we analyze those facts. We come to a conclusion that makes it right for us, and we are convinced. And that means that we trust what we say to ourselves. In other words, we believe what we say to ourselves more than we believe what anybody else says. That's going to be paramount when we get to the new patient and the questions on the conversation. So, how do you know what your new patient is thinking? Well, you plant a few seeds, and you want to talk to the patient in the language of the patient about what matters to the patient. And that sounds real simple, but you know, your information is only as valuable as the patient thinks it is. So that's very, very important. So the discovery, the third part. This is where you use the 7 diagnostic disciplines to diagnose, treatment plan your patient. Periodontal disease concerns, the biocompatible restorative concerns, the cosmetic and orthodontic concerns, the TMD, temporomandibular disorder concerns, occlusal disease concerns, sleep apnea, and any pathology and infections. Those are the 7 diagnostic disciplines that are going to increase your treatment plans and put more on the bottom line for your income, because this is where you get to increase your average new patient value by diagnosing whole body dentistry with the 7 diagnostic disciplines. So this started very recently. Peter Dawson recently published that the oral systemic connection is revolutionizing dentistry, and I could not agree more, because discoveries in science and innovation, and that's where we are right now. We're using this science and we're using innovation with the grid, that we are redirecting the evolution of dentistry to include whole body health and create new value where it wasn't before. We're creating it. Now, this new value is created for improved health for your patient and an increased performance for the practice. Now, the proposal is the fourth part of the grid. The proposal is something that we've always called case presentation. If I've got time, I think I've got a slide. I'm going to tell you how much I dislike the words case presentation. I still don't like going into a case presentation appointment. In the old way of thinking, so this is where you explain to the new patient how you're going to fix their teeth, treat their gum disease, figure out how you're going to get them to say yes. And in dental school, this is how we were all trained. We sit with the patient, go through it item by item, kind of figure out how we're going to educate that patient to our way of thinking. You know, we formalize that plan, we memorize it for patient presentation, we follow the steps, but the students are not taught how to take into the emotions of the patient and justifications of trust and price. So it leaves a lot to be desired when it comes out into the real world. So I always thought a case presentation, several things come into my mind, like cold case, like you can't solve it, so it's a case presentation, it's not solvable, so I got a roadblock immediately. Or sometimes I think of it as like, you know, it's on the docket in courtroom number 2 or something for them to litigate, you know. So a case doesn't sit well with me there. And also when it comes to presentation, I always thought of some guy in a suit with a whiteboard showing something to somebody. There's no engagement. It's just a presentation. So I've always objected to the case presentation. I prefer to call it the proposal, and we won't cover that on tonight's webinar, but the proposal is where you propose solutions that fit the wants, the needs, and the desires of your new patient, rather than presenting a case presentation. Now, the agreement. It's the last part of the 5-step formula for the new patient grid, and this is where you come to agreements with your new patient, because it's your only chance to make a good lasting impression. Extremely important, because this you're going to figure out how is the new patient going to be treated? How is that new patient going to schedule? How is that new patient going to be on time for the appointments? And how is the patient going to pay promptly and in full? Those agreements are important for a successful, profitable practice. So I'm going to spend a lot of time right now on the conversation because I think it's extremely valuable in understanding where your new patient is and where your new patient wants to go, and how to influence them to see the need for your care. So this is the conversation. It is a series of questions designed to start the new patient thinking not about money, not about fear, not about time, not about pain, but only about need and urgency, because need trumps time and urgency trumps money every single time, every single time. So if you create the need and the urgency, it's your golden ticket right there. So the patient really has to see the need and the urgency for themselves, because you can't instill or create a pressing problem in someone else's mind like we did in dental school, where we've got to convince them to accept the treatment plan. You can only awaken a pressing need in someone when it's already there. So let me just read this slide, because there's a lot here, but it's very important to this conversation. Everybody's driven by their own self-interest. We know this. And we buy things that are aligned in our self-interests. And it's very easy to take action on things that we think about and think that we have initiated ourselves. And your treatment plan will be accepted if it's the new patient's idea in the first place, and you'll see this happen tonight. They will be convinced by somebody they already trust, themselves. So very powerful. So this conversation is going to revolve around a series of questions to find out where the patient wants to be, find out where they are now, and lead them toward the right steps they need to take to achieve the goals they have for themselves. So the questions are going to probe, what are their goals? What do they want to accomplish? And we're going to lead them in the direction of our best care to achieve those goals. So it just helps them see that bridge, take from where they are right now to where they want to be. But where do they want to be? How do you know this? Well, there's the top 10 new patient questions, and they tell you what they want, and you tell them how to get there with the least amount of problems. It happens for the rest of their life. It's a good program for them to have the least amount of problems for the rest of their life. So the setup is this. Let me just go through the first things that I would do in the office to set this up. Now, my clinical assistant introduces me to the new patient. Now, I used to do it the other way around. I used to walk in and it was all about me, you know, like she'd say, well, you know, Dr. Evans, or new patient, here, this is Dr. Evans, and it would be like, okay, here I am, you know, everything can start now, I'm here, everything's good. But you'll find out it's not all about me. It's not all about us. It's about the patient. The patient is the star. So you've got to start giving the new patient some small results and some small victories all along the way, so they see those results that they're getting, and it makes sense to them to continue on with the conversation because they're getting the results that they want, and they're small. Now, so the clinical assistant introduces you to the new patient, and this is just done with a little bit of twinkle in your eye and a smile, and I don't want you to pick up the mirror or the Explorer at this time. As a matter of fact, I want you to pick up a pen. I want you to ask the top 10 new patient questions, and at the end of it, I'll tell you, there's going to be a way that I'll get you my cheat sheet for the top 10 new questions. At the end of the discussion tonight, I want you to listen to the answers to the top 10 new questions, and I want you to write them down. And there's reasons to do each one of these steps down. And I'm going to be just as clear as I can be as we go through tonight. And I'm going to go very quickly through everything because I speak quickly. But if you've got questions, put them in the chat box, because at the end of our webinar tonight, I'm going to have a link in that chat box, if Danny has got that ready for us, that you can go to where you can get some of these resources that we're going to be talking about tonight. So,
hey, you know what, Peter? I'll tell you what.
Yeah.
Since you mentioned it, and because I have such a short attention span, no, just we might as well get it out to them now. I'm going to go ahead and send it, and anybody, you ought to be able to simply click on it, and it will take you to the appropriate destination. If it doesn't, if you have any issues with it, just let me know. And for those of you who maybe are not actually on both logged in, you're just dialed in, rest assured that we will make this available to you as a part of a follow-up email. So here it goes.
all right, so that'll be ready for you. But I'm going to ask a favor of everybody too. Don't jump in on that right now. There's a bargain for you there. I guarantee it, for a couple of reasons. There's a bargain there, but I want you just to hear the logic behind what we're going to cover tonight, because it's going to make sense. So I set that stage by saying, the clinical assistant introduces me and to the new patient, because the patient is the star. And I walk in, instead of like saying, well, here I am, and it can all start there, I approach it more like a walk in and she's introduced to me, and it's like, there you are, like an old friend, like an awakening kind of thing. So there you are. That's the kind of attitude I take when I see a new patient. It's like, well, how are you, So let me go ahead and start with the top 10 new patient questions. Let me tell them all to you right now, and we'll go through them one by one. Number one, how can I help you? What kind of dentist are you looking for? Have you ever had any bad experiences at the dentist? What makes a good dentist? What would you like to accomplish? What will you be interested in? Short-term, long-term solutions? Are you going to, that's a special question right there, that the patient's concern will pop into that question right there. And so what's going to get in the way of you getting the work done? Does this seem like an effective plan to you? And the last one is, would you like some help implementing the plan? Now, each one of these questions I'll go through in detail. I've shortened them up a little bit here right now, but we'll go through each one of these in detail. You'll see the logic behind this, and it's going to be more of the science of psychology rather than the science of microbiology and immunology and things like that we learned in dental school. So, the first question. So Jennifer, you're at the dentist today. How can I help you? Now, I want to stop and let that statement just sink in for a second, because it lets the patient know that you understand what going to the dentist can mean to someone. Now, when I say this, I split it. Every time you see that ellipsis there, I kind of pause in my question. So I say, so Jennifer, you're at the dentist today. Now, the patient can breathe a little bit of a sigh of relief, kind of know how difficult it might be for them, and with no more conversation other than, the new patient may just roll their eyes and said, yep, I'm here, Then I ask with a smile and a twinkle in my eye, says, how can I help you? And then I sit down, eye to eye, knee to knee, the patient's not leaning back, and I write down what the patient tells me. Now, this tells you what you need to do for the patient, because they're going to tell you the list of things they want. Either, hey, I'm just here for a cleaning, or, hey, I've been thinking about being more healthy, my gums bleed, or I've read about mercury fillings, or, my teeth are shifting. Whatever their concerns are what you need to write down. So you need to be quiet. You need to listen. You need to be quiet at this time as you write down what she tells you, because these are the precise items you need to pay attention to. Now, along with question number 5, this is going to give you the goals of the patient. She's telling you the issues that she wants in her treatment plan. She's telling you all her concerns. And if you're eye to eye and knee to knee with the patient, You probably have something to write on, and like I said, I've got a cheat sheet that I'll tell you how to get at the end. This is what I put on the clipboard when I talk to a patient. There's spaces on there where you write the patient's answers down, and I'll tell you why later, but it's critically important that you write down what the patients tell you. So after the first question, the patient's telling you what they want. You know, they may see your advertisement, come in for a cleaning. They may want to be mercury-free, or maybe it's just they've been 10 years and they're just getting to a dentist because they know they're going downhill. So write that down. Don't leave it to your memory. More than likely, the patient has never had anyone pay attention to them like this before. You've now placed yourself in a category of one. You are different. Now, it's placing a seed in the subconscious of the patient that you are different, and you're only going to differentiate yourself more as the new patient grid continues. So after they have explained how you can help them, which usually kind of includes a discussion of the past dentists and their past dental work, I ask question number 2. So, you know, Jennifer, what kind of dentist are you looking for? Now, this is why the patient is in your office. Either you are insurance-based and you're on their list as a provider, or they've looked you up online and they know that you do great cosmetic work, or maybe you are an alternative excuse me, dentist who follows protocol with materials and methods and procedures, because they might think, and I think they do, they might think that all dentists are the same. So maybe, you know, maybe they want to be healthy, maybe they want to be beautiful, maybe they want to keep their teeth forever. Patients have never been asked this question before by any dentist. So it may take them by surprise because they think we're all alike. So if they don't have the answer for this, that's okay. But what it does, it puts a question in their mind that you know something, that you know that they're a difference, and it starts to water that seed that you placed in their mind with question number 1, that you are different. And now it places another seed that you are knowledgeable, because you know their differences in our offices. So yes, you are different because you know this. So if you are starting to differentiate yourself even more, but remember to write the answers down. So you've got some good intelligence to work with right now. You've planted 2 seeds already. So what kind of dentist is the patient looking for? It blends right into the next question, and question number 3. And I ask this question kind of off the cuff, like a couple of the questions are like this, like it just comes to me, like I say, you know, have you ever had any bad experiences at the dentist? And I ask that question kind of like it's just coming to me, and I want you to write the answer down, because this is why the patient is in the office. Now, we don't know what the patient has gone through in the past. Maybe as a child, not quite happy with it. Maybe old Mrs. Bailey is 88 years old and this is what she remembers. Or, you know, there's a picture of my dentist right there. That's what I remember. Or, you know, maybe it was like my procedure this afternoon where I was, you know, doing an extraction. You know, you just don't know what the patient is thinking, but you want to show your compassion here. If they've had bad experiences, you don't want to justify them. You don't want to do anything except just agree and be compassionate. So this plants a whole nother seed, continues to say that you are different and you are compassionate. So the next question after that, and the magic has already started with this. They are answering questions they've never thought of. You know, you're asking me all these kind of questions, and no dentist has ever talked to me like, nobody has ever taken a couple of minutes to talk to me before I have picked up the mirror and explored and start poking at my teeth. But immediately after question number 3, and they say, oh yeah, boy, I tell you, when I was a kid, no Novocaine. They just went right after it. Or, hey, my wisdom tooth that guy had to put he cracked him in half, and I was swollen like a chicken. So directly after what they say, if they've had any bad experiences, I say, so Jennifer, what makes a good dentist? You know, in your eyes, what makes a good dentist? Now, this is off the cuff again, like it's an afterthought to me, and it just came to me. And I might lean back in my chair just a bit, be more casual as I pause between where that ellipsis is. I'm going to pause between there to make it very spontaneous, very conversational. I say, hey, you know, what makes a good dentist? You know, in your eyes, what makes a good dentist? So that will take them a minute or two to kind of think about that, because now they're thinking about what kind of qualities they want in a dentist. You know, nobody's ever asked them this question before, but listen to this answer very, very carefully, because this is who you need to be for the patient. You need to exemplify the things that she is going to tell you right now. Now, she might say, well, I don't know, someone who's pleasant, you know, somebody who gives me options, somebody who's honest, or, you know, another patient might say, you know, hey, somebody who's painless, you know, and gentle and knowledgeable. Now, I use this question very intentionally to kind of gain some kind of like an icebreaker, because when they say somebody wants to be, they need a painless dentist, or somebody who's gentle or knowledgeable, well, it's right at that time, and this is intentional by me, it's right at that time that I'll turn to my assistant and I said, oh, we were doing so good until we had to be knowledgeable. Well, every single time that's going to get a chuckle out of the new patient, because they don't expect that. They know you're knowledgeable. They don't expect you to come back and have a bit of a quip about that. So I'll tell them, it says, oh, we were so good until that last thing about being honest, you know, and then I'll stop immediately. It always gets a chuckle, but I stop immediately. It says, no, Jennifer, I'm kidding. He said, Jennifer, you're in a very good office. You will have my best skill and attention. So I back it up with some very intentional words on how good we are at the office. Now, the seed that you're planting here is that you are confident, you are fun, and you are kind of agreeable to be with. Your confidence has got to show through like gangbusters right about now. You're going to continually differentiate yourself, continue to build this relationship with your new patient. Now, an interesting thing happens right here. You want to be sure you are actively listening. You need to interrupt if you're not clear about something the patient's talking about, but you let the patient talk, because this is important. Studies have shown that the longer someone talks to you, the more they like you. Now, that's weird, isn't it? But the longer you let the new patient talk, the more they like you. So all of this works because it's not about you or your office or your position or your anything. It's about them. So you let the new patient talk, you listen, and you win. Now, at this point, I probe after question number 4, I probe a little bit deeper into the kind of dentistry that they have in their mouth right now. Probably have x-rays up by now, so I'm able to see things out of the corner of my eye. I'm gathering a little more intel that I need to create their treatment plan for their health, and I ask about, you know, hey, got any tooth-colored fillings, any mercury fillings, any extractions, any gold crowns, any TMJ problems, any pain at your ears? Do you have partial dentures? If you had braces, implants, do you snore? Any gum surgeries? Any guards to protect your bite, or sports guards? All those questions. And I'll show you in just a minute, all those questions come from the 7 diagnostic disciplines. So I want to know the kind of dentistry the patient has purchased in the past, and I want them to understand that everything I just covered is part of their dental health, and all of it's important. So I ask for some specific issues. If the patient has led me in a specific direction, if they said something about, yeah, my gums are bleeding, or I'm thinking about having my mercury fillings removed, or I don't like the appearance of my teeth, that's going to pop up in question number 7. I'll show you that when we get there. So this is my cheat sheet, and I'll show you how you can get this at the end. But this is my cheat sheet, and right in the middle of that, right above where it says page 1 in the middle of that, that is an area where I'm going to ask them everything. I said, any problems with cavities, any gum disease that you know about, any sensitive teeth, how does your bite fit together, any cosmetic concerns, any braces, any implants. I'm going to just go quickly and just circle yes, no, yes, no, yes, no, yes, no, yes, no, yes, no. And then at that point, I know that they know I'm asking these questions because all those things matter in their dentistry. Each one is part of the 7 diagnostic disciplines. So at this point, right before question number 5, I ask, I should have showed you that right between question number 4 and 5, this is that series of yes and no's that I go through just to cover the 7 diagnostic disciplines. So when I say something, it doesn't come as a surprise if I talk about they snore, or whether they've got a night guard, or whether they've had any gum surgeries or crown and bridge or extractions. So nothing's going to be a surprise because I've covered it before. So these address all of the 7 diagnostic disciplines. Now, at this time, I ask a very strange question, and this comes immediately. It's like I'm still writing things down and circling things as I ask them about, do you snore, or do you have a guard to protect your mouth? I just say, how long are you going to live? And I ask this question so quickly that sometimes my head isn't even off of my my sheet that I'm writing. Many patients, they're like immediately confused, and they say, excuse me, you know? And that's what I want. I want that pattern interrupt right there. This is a different kind of conversation than they've ever had before. I'm planting another seed here, and I want it planted deep. I'm going for an emotional response here, and you're going to return to these emotions later on when your proposal happens at case presentation. Now, some patients are going to say, you know, well, hell, as long as the Lord let me, you know, or they may say, you know, hey, my mother and my grandmother or somebody lived to 94 years old. And that's good. So I confirm that they've got good genes, and I've got to make a plan that's going to get to 94 years old with the least amount of problems. So I ask immediately right now the second under the radar question. So if you're going to be 94 years old, are you going to keep your teeth? Now, this is really interesting because almost 100% of the time they say, immediately they say, I plan to. Like, are you crazy? Yeah, I plan to. So I now have created a situation where I have permission to think long-range goals and to create a treatment plan that addresses everything. So I tell the patient, well, Jennifer, if it's all right with you, I'm going to create that plan to ensure that you have your teeth in good shape with the least amount of problems for when you're 94. Is that okay with you? Now, I want you to see what just happened. Hopefully a light bulb just went on for you, because this is huge. That's the piece of intel that we're looking for. That's the end point on the grid. That's our objective. That's the mission, to help Jennifer keep her teeth and be as healthy as possible to reach age 94 with the least amount of problems. Now you've got permission to create a treatment plan that addresses perio and mercury fillings and cracks and snoring and missing teeth and occlusal disease, every one of the 7 diagnostic disciplines, everything that will aid Jennifer in our mission. This builds tremendous value into your treatment plan. Now, with the questions, number 1 question, 2 question, 3 question, 4 question, you're building your file of the intelligence that you're going to need. You've planted the seeds to grow in that patient's subconscious. They are the seeds of compassion, the seeds of fun, the seeds that you're confident, you're agreeable, positive expectations for the patients. You're starting to get some power behind your conversation now. Now, you may have noticed that a lot of these questions are designed to get the answer yes from the patient. And you've had the patient kind of commit themselves to what they want for their own health. Now, it's purposely designed to allow the patient to be consistent with that commitment of health for themselves. They are convincing themselves that the direction to pursue is health, and it's going to be their own idea. This is a natural progression for like human beings to do this, to be consistent with their commitments. So once you've got them saying yes, once you've got Jennifer saying yes, that's a good idea to build this plan that we're talking about to get me to be 94 years old. We're just drawing out what the patient wants, needs, and desires. Create that atmosphere where the new patient reaffirms their commitment. And now it's time to bring in the reinforcements. So this is the seed of hope that you're going to get them to be 94 years old with the least amount of problems, and you've gotten an agreement and permission to do so. So the situation you've created, she's just given you permission to generate the treatment plan, keeps her teeth as healthy as possible, 94 years old with the least amount of problems. So this is it. You don't go into the situation and not know the grid. You and Jennifer are now clear on the situation and the objective to develop a plan for her health. It's Jennifer's idea in the first place. This is golden. Now, I kind of want to bring in some reinforcements right now. I don't want this to drop. I want to bring reinforcements. So question number 5. It's a little bit awkward to say, but you slow it down, and it's very intentional. It said, Jennifer, in our work together, what would you like to accomplish? What will your goals be? And you need to write this down. This is what, along with question number 1, this is what the new patient is explaining to you. This is what you need to do for the patient. So, a little bit difficult question to get underneath and say comfortably, but it's intentional. What will your goals be? So, it's kind of presumptuous in a way. It says in our work together, it's like this plants the seed in the patient's subconscious that you will be working together on whatever the patient wants to accomplish. And it shows that you are listening. And the question it finishes with like, what will your goals be? Which speaks to the patient's plan in the future tense and gives the plan a sense of like foresight and preparation and positive experiences and expectations. So write the answer down. This is what you need to do for the patient. So gives positive expectations also, so the patient is now thinking, yes, I want that. And more importantly, by including yourself in this patient, the patient has just started to work with you and given you permission to use these goals. Your job now is to create a plan so the patient can accomplish her goals. So if you go to question number 6 right now, it's bringing in more kind of reinforcements. So question number 6 is, so Jennifer, if I find a problem during your exam, will you be interested in short-term or long-term solutions? Again, this is just getting a commitment to her goals that she's already stated to you. Now this is where the patient's thinking is. It's either in the present or the future. Now, of course, there's going to be some short-term goals that need to be accomplished. You know, she needs to buy a water pick, or she might, she might be so ill that you want to test for the biocompatibility of the materials that you need to rebuild this patient. But what you want to do is to agree on long-term thinking. So, if the patient agrees, then they just committed to health at an old age with the least amount of problems. So it provides an opportunity to be consistent, again, with their commitments, and subconsciously just send in the reinforcements. So that's nice. Now, it's down on paper. Now you've got it recorded. Long-term solutions, and you can create the plan to get her there. So this is starting to build the foundation of the base work and the baseline work that gets you this average new patient value that we talked about originally, rather than just $1,500. This is going to, along with the 7 diagnostic disciplines, this is going to put you at 2 to 3 times the national average, if you can see that. Am I right? So once you're clear on the short-term goals and the long-term goals, write those answers down. You ask question number 7. So question number 7 can be anything that they brought up in their first concerns that showed up in the conversation right after question number 4. Now that was that area right here between question number 4 and question number 5. This just gives you a track to run on. This cheat sheet gives you a track to run on so you can't fall off. So they may be interested in cosmetics because they're getting married in 6 months and want veneers. They may be interested in becoming mercury-free or metal-free. They may be interested in anything. Whatever it is, this is your cue to say question number 7. So it might be like, are you concerned with how your teeth are wearing down? If they say, you know, my teeth are chipping up all in front, they're getting real thin, you know, what's going on with my bite? Well, okay, so it's occlusal disease at this time. Or question number 7 can be if you understood that they were having bad tastes and things bled when they brushed their teeth. And you could ask, does the inflammation in your body caused by your gum disease give you any reason for concern? You need to ask that question to say, yes, you need to nail it down. Or, you know, a simple thing, said, are you going to keep your mercury fillings? Very simple things. But this tells you how interested the patient is in the current health issues that you've got. And are they consistent with their previous commitment? So there is a sense of urgency when you address, are you concerned about the wearing down of your teeth and they're chipping because they're so thin? Are you concerned about the inflammation in your body? This might be a patient who had Hashimoto's or Lyme disease or some kind of immunosuppressed condition in their body. They're going to be concerned with an additional inflammatory burden on the body if they've got perio problems. And so each one of these gives you a sense of urgency. Question number 8, I just throw up a roadblock here. I want to see how far they know where they are in this conversation. So question number 8 says, again, this is a little bit difficult for delivery, but I want you to look at this question because it's designed specifically and intentionally. So I ask, what will get in your way of successfully getting what you're telling me you want? Okay, I don't ask, hey, are there any problems with you continuing with what we come up with? That just doesn't get it. And, you know, if I say anything going to get in the way of you doing this, first of all, if you say anything, that opens up the gate for 100 different things that could cross their mind. It's just too vague. So I've written this question to challenge them. The first part of the question is, what will get in your way? Okay, that throws up an immediate challenge. You know, when they have been consistent with their commitments during the whole conversation, you can imagine that they might think, well, you know, nothing's going to get in the way. I've told you what I wanted, and I want to do that. Now, the second part is of successfully getting. Now, failure comes into the question here, and no one wants to fail on their commitments, so that's important there. And so the last part is what you're telling me you want. This is not something that I created, that I did a dentition exam and a perio recordings of the pocket depths. This is not something that I found. This is something that they want. It's very specific. In other words, it's their words. It's the plan of something that they have co-generated. And that's why this is a very specific question. So Jennifer, what will get in your way of successfully getting what you're telling me you want? Okay. Now, I can't tell you how this question has charged up my confidence. Now, I now have a script and a track to run, and it makes it so much easier to feel confident. So directly after this, write down their questions. There's going to be some things here. There's going to be, if they say nothing, then wonderful, wonderful. But if there are issues, these are just obstacles that need to be handled before you can start and continue the case. They're issues, they're objections that need addressing. They don't need to be overcome. It's not like you can overcome objections. That's too tough. You just need to handle them. You need to make things affordable if money is a problem. If timing is a problem, you may make appointments earlier rather than later. So this question helps you address and facilitate handling any objections. You want to give a lot of time understanding the patient's concerns. You want to listen to the patient. Most of us are going to listen with the intent to reply. It's how we always work. I want you to listen with the intent to understand. So write the answers down, very important. It says when you write down what the patient is telling you, it shows the patient that you've been listening, and when the patient sees that you're trying to understand them, this is the beginning of trust. Now, you've planted seeds that grow into conversations that speak to the fact that you are different, you are understanding, you're fun and agreeable, you're creative, creating positive expectations, you're offering hope, you're stressing urgency, and that you're very knowledgeable and very smart. So these points are huge at this point right now. People do business with people they like. And the more you let the new patient talk, the more they like you. Very important. Now, people buy from people they trust, and when someone feels like you understand them, they're going to soon feel that you have the answers. Now, let me say that in a little different way. If the new patient feels you understand them, they'll soon feel that you can help them. Very powerful. It's called trust. It's an invisible power that we have. Now, a friend of mine, Dominic, once told me that on a visit to a new doctor, in their initial conversation, the doctor was writing down what he said, his concerns, and he was so impressed. Now, the doctor thought that Dominic was saying things important enough to jot down and remember, physician's empathy, physician's attitude. Well, it made Dominic feel that he was being taken care of very well. He felt important and cared for. And this is how your new patient will feel. So again, if the new patient feels you understand them, they're going to feel like you've got the answers. Now, at this time, we've discovered why the new patient is in your office, what the new patient wants, who the patient is, when the new patient wants to start treatment, how the patient wants to be treated, where the new patient's thinking is, like future-based or present-based, and this is what we're going to discover. You want to find out what the patient wants, influence your patient in a positive way and in an ethical manner to help the patient perceive the need for your care, accept what you're saying, and move forward with your best option dentistry. So, at this time, you can pick up your Mirror and Explorer and start your examination, gather all your records with the 7 diagnostic disciplines, and get your dentition records, get your perio probings, take your photographs, do whatever you want to do to now gather your diagnostic records. So when you're done, you could sit the patient up, and if the case is relatively small, you can talk about your findings with the patient immediately because you're going to provide a solution to what the patient wants. So if it's small, you can ask immediately. Question number 9, does this seem like an effective plan to you? Again, commitment and consistency. This confirms that the patient's perception of your ability and willingness to help them is great, and it shows the patient's level of trust in you. The last question is the toughest because now we figure, oh, I got to sell the case, I've got to present the case, I've got to close the deal. All those things that completely frustrated me. I was flustered. I'd fiddle with my pants leg. I'd run my hand through my hair. I'd fiddle with my pens. Not confident at all. But this question solved that for me. It says, would you like me to help you implement the plan going forward? If they think it's a good plan, an effective plan to begin with, just ask them, would you like some help? Very simple. Would you like me to help you implement the plan going forward? So that verifies the patient's level of trust and cooperation with you. So those are the 10 new patient questions, and that is the 5-step formula for the new patient grid. It involves the discovery, which is the 7 diagnostic disciplines. Now, I want to go through a couple of them because I'm going to show you a couple of things that help me out when I start working a new patient exam with the first 5-10 minutes going through those top 10 new patient questions. One of the first things I do is I look for perio. So let's just start there because I have natural products in my office for good reasons. Periodontal disease is the most common chronic inflammatory disease on the planet, and we are charged with its diagnosis and treatment. If you use the 7 diagnostic disciplines, you can add $250,000 to $6,000 for your periodontal treatment for the patient. Natural products in line with whole body health and advancing the oral systemic connection by Peter Dawson's own publications. So the next one. Now this is good for me because I use tooth and gum tonic from the Dental Herb Company for all my perio patients and perio maintenance. But here's the kicker. I want to show you something else that we use Dental Herb Company tooth and gum tonic for, and it's Quadrant dental care. So I want to show you a couple of things. We use biocompatible materials. It can add $250,000 to $20,000 to your treatment plan. We use express checkout because when I do Quadrant dental care, it may take, 2 hours. We may do filling in an onlay and a crown and do a Quadrant care. But we have express checkout, so they pay for it and in full at the front desk before they come back for treatment because they're pretty beat up. You do a Quadrant of dentistry, it's pretty beat up, and because I want to get my impressions perfect and I get the gums out of the way and go for it. So I use tooth and gum tonic in a special way, not just for perio. I use it for operative, and I'm going to show you that right now. This is very cool. With a Quadrant care, this is a full coverage crown and 3 on the premolar tooth number, that must be 12, I guess. 13's an onlay, 14's onlay, 15's an onlay. So my provisionals are all tied together. And I do this because I don't want 4 chances for a provisional to fail. I just want 1 chance for a provisional to fail. So it's sculptured in the embrasures there to allow water picks, but also it allows them to swish with tooth and gum tonics. And I give every single Quadrant patient that we deal with a small bottle, like the bottom right down there, that they'll use for the next 2 weeks with these provisionals in them, so the gums are looking healthy when they come back, because you can't do non-metal dentistry with a bunch of pus and blood and contaminants all over the place. So I use a repair kit with some temporary cement and instructions. I use the small bottle of the Tooth and Gums tonic, post-op instructions, and again, express checkout. Now, my repair kit just has instructions and some temporary cement and a small bottle of the Tooth and Gums tonic. And this is what everybody goes home with when I get Quadrant dentistry on the schedule. So another case of Quadrant dentistry, there's 3 mercury fillings. Some of those margins are subgingival, so after all is prepped, a DO composite resin in 29, full coverage on 30, and an onlay on 31. I've beat up the gums pretty much going around. These are the provisionals on, so they're cleansable, and when the tissues come back, they look pretty good. So that's what they look like before. That's what they look like 2 weeks later when the patient comes back. And it all is accounted for tooth and gum tonics, help the patient keep everything clean while those provisionals, because I've got them all tied together, they cannot floss. Now, the cool thing about this is that my front desk tells me that when I send them home with a small bottle of tonic, 80% of the time, these aren't even perio patients, 80% of the time though, they come back and want a large bottle of it on a regular basis because it's fresh breath. It's been shown, Dental Herb Company's got studies that show periodontal health, fresh breath, and so I like it both for those things. So, periodontal therapy, yes. Quadrant restorative care, absolutely. Biocompatible materials, yes. Add to your treatment plan, express checkout, and I do like the tooth and gum tonic in all of my perio patients and in my restorative Quadrant care patients. So the cool thing is about it, it has gotten to be a profit center and in the practice because of that. Very nice. Now, I want to wrap up everything because Dental Herb Company has offered a nice special for everyone tonight, for all new customers that are on tonight. And this is pretty big. This is 25% off all orders before the end of the month, September 30th, 2016. That's huge. That's good. But Greg Carlins, who is the marketing director, Greg said we're going to give 25% off all orders for existing customers too. This is huge because I just ordered a case or two a couple of weeks ago before I knew he was going to offer this. But call Greg Carlins at 1-800-747-4372. Tell him that you're on the Evans webinar and you got 25% off all orders. I'm going to show you this again at the end also. So write that down if you don't, but I'll show it to you before we quit. So that's one very nice offer from the Dental Herb Company. And Greg, I know you're listening. I appreciate everything that you do to get patients healthier. And you're giving a break to all of our offices. I thank you. Very much appreciated on my part. Now, let me tell you how I want to help you with the new patient grid also. There's a 5-step formula for the new patient grid. We talked mostly about the conversation tonight because the discovery is the exam, diagnostics, and things like that. I'm going to show you how I can help with that without having to go through a lot of it, but I can get you that cheat sheet also. So I've got a special offer number 2. We've got a special 36-page report on the 7 diagnostic disciplines. It covers perio, the restorative concerns, the cosmetic concerns, TMD, occlusal disease, and I put occlusal disease down here at number 5. That ought to be up at like number 3 or something. It ought to be right after perio, caries, and restorative stuff with biocompatible materials, and then right after that, occlusal disease, because we are seeing like it's an epidemic. It ought to be higher on the list, I think. But after that, sleep apnea, and after that, pathology and infections. Those are the 7 diagnostic disciplines, and we've got a 36-page report that goes through every single discipline. It also has a self-test in there that you can actually test yourself and rate yourself on each one of these disciplines to see, do you have a system to diagnose, and do you implement that system? Have you got a system but you refer some of those diagnostic disciplines, and you've got a system but you don't implement or refer, or maybe you just have no system at all? Anywhere along here you can increase with these 7 diagnostic disciplines. This is where you're going to increase your average new patient value. And when you use the top 10 new patient questions to kind of have that new patient co-generate a treatment plan, and then you use your 7 diagnostic disciplines, your new patient average value is going to double, triple the new patient average value nationally. So the self-test is there. There's also, inside this 36-page report, there are a sheet for standards and criteria for every single discipline. Now, you've got the standards and the criteria for reporting periodontal concerns. Now, these sheets are fabulous for your hygienist, fabulous, so you can educate your hygienist. There's restorative concerns, aesthetic concerns, criteria for TMD, standards and criteria for reporting sleep apnea from your hygienist and from you, infections and pathology and occlusal disease too. All of those are included. So that is a 36-page report. Also, I want to get you that cheat sheet on the top 10 new patient questions, that page right there. I can get you that also. Now, normally these things come in other programs that we have, but I've split this off for $57. The special offer number 2, the report for the 7 diagnostic disciplines, and the cheat sheet for the top 10 new patient questions. Extremely valuable, so you've got a track to run on to ask those questions. Now, for tonight, I'm going to drop that to $27, and I'm going to add a bonus. Now this is kind of cool. Our membership have the BioCompatible report. It is a membership newsletter, and for $27, the newsletter is a 6-page monthly newsletter. It's got verbal skills in it. It's got make it worth your while. It's got a topic in there about something you can put implement it on Monday morning to boost the bottom line. You know, so if I can't make you any more than put an extra filling on the and that's about all this costs is put an extra filling every month. If I can't do that, then you don't need to listen to me anymore. You can stop. But that's got verbal skills in it. It's got case presentation in it. It's got staff issues in it. Everything comes in a 6-page. We also have a video training, monthly video training online that comes up where I explain something that's in the newsletter in depth, so you actually see it in effect. And this is huge. There's a call-in day where you and I can get on the phone. There's a monthly call-in day, and that is huge, where we can just delve into any problem that you have or clarification about the top 10 questions or anything. So that is huge. Our monthly members get that, and you will get that also for 2 months. Now, the rest of it is weekly emails and update, new content that comes out. Science is coming out all the time on whole body health and how our dentistry impacts the whole body health of our patients. And all this gets mailed to your doorstep. Now, it's regularly $197 a month, but as a bonus, it is yours. So, Dental Herb Company's got 25% off your next order, existing and current customers. So, there's the telephone number, 1-800-747-4372. Just mention Evan's webinar. You can also just get complimentary samples by go to trythetonic.com. Request the samples. Very easy. Now, for me, 7 diagnostic disciplines with a 38-page report, the cheat sheet on the top 10 new patient questions, that's for $27. Very easily done. The link is right down there at the bottom, and that's going to be in your chat box also, so you can just click on that or copy it and put it in your browser. You're going to get the bonus 2-month subscription to the BioCompatible report with the monthly video training series and the call-in day where you and I get to tackle some of your tough questions. So this is my last slide. Just click on that chat box thing, and it'll take you right to a page where you can get these bonuses and products, and click on trythetonic.com or call Greg Carlins and tell him that you've been on the Evans webinar, and 25% is yours. So that leaves me with a little bit of time for questions and answers, for some Q&A, and I'd be happy to cover all of those. If Danny, if there's any questions, or if you've got any questions yourself about what we've covered, so it's more clear for everybody listening, let's go ahead and cover some.
We do indeed, Peter, and I've got a comment too, which is just again to thank and congratulate you for another great presentation. The thing that always strikes me, and I've shared this with anyone who will listen, is that it's clear that you get the science, but you also get the science of communication. And I think it's unfortunate, and I hope that no one is guilty of that on this call, that clinicians often discount that. They feel somehow that, as they were taught in dental school, and as you alluded to earlier in your presentation, that it's felt that our knowledge is self-evident, and if we present the a cogent argument, that the patient will just accept it. But the subtle but nonetheless powerful and essential science of influence and persuasion is often missing. And that's sad, because if you're offering something, which I know you all are, that will benefit your patients, if they say no, it doesn't just hurt you, it hurts them. and just a lot of the things you talk about, the importance of silence, the importance of really listening to understand, not listening to wait and to prepare your reply, and how you're really building a case when you're doing this, that it's communication, but it is science, and there is a logic to it. And it's not only what you say and how you say it, it's also when you say it. And so I hope that everyone did take really copious notes or will listen to this broadcast again, because what might seem soft is extremely powerful. And in my experience working with clients, they're all good clinicians, and for right or wrong, the successful ones are not the best clinicians. They're the ones that are competent but are excellent communicators. So I hope you will embrace that and take advantage of everything that Peter has offered, because it is a cornucopia of value. It really is. Okay, I'll get off my soapbox, but
thanks, Danny.
I had to say that because you really connect and resonate with me, because I coach people all the time on how to connect on the telephone. So, all right. First question: what if a new patient wants to work but has money concerns? And you've sort of alluded to this, but I think it bears revisiting.
Yeah, that's got to come up, because that's a roadblock. So you can't go by. That's going to be in the question where, you know, what's going to you know, get in the way of you successfully getting what you're telling me you want. You need to address that, because that's something that the new patient can't get past. If they're just, you know, you don't understand, doc, I'm just trying to get by today, you know, I can't do the $4,000 worth of work you're recommending here. Well, you've missed something on the urgency and the need for the patient, that's for sure. But if you've gotten yeses all the way through and gotten agreements all the way through, all you have to do is make that affordable, and you just have to address it. And if you show concern and compassion, saying, listen, when we start this work, you know, Mr. Baxter, I know you've got a concern about finances. Is that you're going to have my best skill and attention with my clinical assistant here. If you talk with Donna up front, you know, she has ways of making things affordable. So let's talk to her. And I stop right there. And we either go to care credit or some other type of funding that makes sense to the patient. So I set it up that my front desk can make things affordable for you, and I don't go too much further than that. So you've got to have staff up front that can really sympathize and be compassionate when somebody needs the work, they want the work, but they've got 4 kids. I mean, we all know this. We all have it in our practices all the time. And if you have to spread it out over 4 years, but that's your lifetime patient right there.
Right.
They're not going anywhere else.
Right, and if they follow the protocol, the communication protocol that you presented, you're going to find far fewer objections of that type, because you're showing people, like you said, you're creating that mystique, that magic, which we call trust, and that just getting people to say yes and to communicate with you gets them comfortable. And when you ask them, I think how you put it, you know, what will get in the way of the treatment, or what might lead to an unsuccessful outcome in our work together, you're inviting the person to kind of go through their own little list of objections. Instead of waiting them to say, I can't afford that, you've already asked them about it, and then you have a conversation. So again, it's not just what is said and how it's said, but when it's said and asked. Yeah. And I love the reminder you give about not being afraid of silence. Silence is very much a part of the communication. I don't know what a good analogy is, but it's like the painting, you know, it has a frame, or the sculpture has stuff that you remove to reveal the actual artwork. It is very much a part of the communication. So don't fear it, embrace it, and know that silence is golden in this context too.
Yeah, I always used to think that, you know, if I talked more, it was adding more value.
Right, right. That's what people think. If you talk more, you're adding more value. Well, less is more.
No, that doesn't work. So I quit that. So
exactly.
So,
all right.
I understand.
How does this work with my hygienist? My hygienist sees all of our new patients.
Your hygienist can see your new patients. There's nothing wrong with that. I particularly, in my practice, I see all new patients to begin with. If you bring new patients to your hygienist, then fine. Those first 4 questions can be initiated by your hygienist very easily, I think. But once you get into the diagnosis and the treatment plan, I don't think new patients want the hygienist to be, they want the dentist doing that. So after question number 4, the dentist is going to come in anyway and can just run through a couple of those. And I see you've been to the dentist before, and so I see you've got all these things, and they can run through after question number 4 those 7 diagnostic disciplines quick, and maybe go right into that under the radar question about, Ms. Baxter, how long are you going to live? And you can start that where are we going with your health in my practice? So you could split this up, I think, pretty easily with the hygienist and the doctor, splitting it around question number 4.
Mm-hmm. Okay, and I just reminded me about that question. I hope everybody gets the power of that too. And again, it's a perfect illustration of if you opened up the conversation when the first question was, "Oh, by the way, Mary, nice to meet you. How long are you going to live?" You have not received permission to ask that question.
No,
and
you can't.
Right?
So you can't be a trusted advisor if nobody's asked for your advice.
Exactly.
Okay, so you got to. These questions they've taken years to design, and it's not. This is not like dental school. This is not our dental school exam where we
had a
did all
captive
our
audience.
records. Captive audience. Oh my gosh, yes. It's you didn't need. I mean, we never got this. What was it? Long-term relationship building 101. I mean, we never got that in dental school. We didn't need it. When the new patients came in, their captive audience. It said the only reason that new patient is there in dental school is money. That's the only reason. If they don't accept your treatment plan, your case presentation, they're out on their butts. You don't need them. What you need is points for graduation. You don't need a long-term relationship with that patient. We never got this in dental school. So you need credits for graduation. You don't need to build that relationship. And the new patient is a totally different thing. Out here with us in our practices, totally different. That patient in dental school is out. If they don't accept, you move on to the next patient because you need endo, you need pedo, you need pros. So totally different. And that's what the new patient grid does.
Any dentist who's been out in the real world for a few years knows the difference. I think the other point that you're making, which maybe is implicit, but I want to make it explicit, is that this is a team exercise. If your hygienist needs to embrace this protocol just as the doctor does, and then when as Peter said, maybe the hygienist can ask the first 4 questions, but your hygienist has got to know why he or she is asking those questions, and understand that this is not just some arbitrarily arranged series of comments or questions. It's like you just said, Peter, this looks simple. It flows easily, but it's the result of years of research on your part about what works and what doesn't. And role plays, asking yourself, well, if somebody asks me how long am I going to live, yeah, that's kind of like a little bit of a shock to the system, and it's intended to be that, to wake them up and to start thinking, and also drop barriers so that you're communicating on an even deeper level of trust.
It's another verbal skill that I'll use, and sometimes, it's like retirement planning. Okay, you're going to be 75, you're going to be 85, you're going to be 95 someday. So there's things you have to do today to get that result when you're 95. So it's part of like, retirement or funding your retirement program. So you got to start this today. So let's start this today. If you expect health and beauty at 95. And we can do that. We can stop the aging process in the mouth. We know that. People can look gorgeous at 95 with great teeth.
Right.
So
you got to get them to visualize, first to acknowledge that they want that, and then to show them how they can achieve it. And it's a plan that has to begin now. Exactly. Well, it's
you were paying attention, weren't you? I'll be down on you. That is great.
You're preaching to the choir here, buddy.
I got it. I got it.
And I've also heard you a couple of times. You know, we go back. But that's kind of a nice segue into the next question, which is about the what kind of dentist. What kind of answers do you get? And it's a multiple compound question. How do you respond to those answers? To the what kind of dentist are you looking for? I guess in other words, he's asking how many offer anything other than a variant of aren't all dentists alike? So, you know, when you're asking that question, how frequently does somebody come back and say, I want a dentist who's concerned with my longevity and biocompatibility issues, or somebody will just say, well, aren't all dentists alike?
That's the question that splits the men from the boys straight away. If somebody is just looking for their insurance needs, then wonderful, maximize their benefits, love them to death. But somebody will say, you know, I was on your website and I noticed that you do bioceramic implants, and you know, I don't want the titanium implants. So boom, you know somebody's looking at their health. And at that point in time, you need to look at their health history, find out if they're immunocompromised, find out if they've got thyroid problems, find out if they've got anything going on that you're going to need to know so you don't add to that burden to their body. But that's the question that say, well, you know, I'm just trying to get my insurance benefits, so you know where that patient's categorized. Or that says, you know, hey, my sister and Ashland just got all their mercury fillings removed, and I've been thinking about that myself, and I saw on your website, blah, blah, blah. That's the question that separates the person where you know where you want to go for your talk.
Gotcha. Next question. When do you take x-rays or go over the health history?
Yeah, that's not covered. That's not covered here like in the introduction. That can happen in lots of places. A lot of people just, you know, they're going to send in their films and email them right in. If I don't have them, we take them before I see the patient. So that happens. My clinical assistant will go in and introduce herself and say, before we see Dr. Evans, I needed to gather some current records, and she will take a little bit of a health history update and clarify that health history and take radiographs at that time. So I like to see the x-rays there when I'm first introduced to the new patient. Now, during the exam, I may see something about a root canal that I don't like. I want to see a PA of this root canal or something else. Then we'll take additional x-rays when I'm aware of that. But yeah, that x-rays would happen probably before, if we don't have them, probably before I see the patient for that initial conversation.
Excellent. Okay, I was just responding to somebody who was asking about how to get a free sample, and I just reminded him you'll get an email after the presentation, or you can follow the link. I am interested in the part about the agreement. Can you give us more information about the workshop?
The agreement. The agreement's a whole step of the new patient grid that's not anymore. It's not complex, but you do have to train your patients to how do they want to be treated. What kind of agreements are you going to get into? This is, you know, we don't have legal agreements where, you know, sign on the dotted line, I'll get a notary public is going to, you know, no, this is not it. But I guarantee you when a patient comes in, they have been trained by all the other offices they've ever been in, which is not usually good at times because they, you know, I'll write you a check, I'll send you a check after this, or, you know, they show up late for appointments and all that stuff, which bothers me because I am on time for my appointments, and I want people to pay in full and promptly. So we literally have agreements where some of it's verbal, some of it's just stated on pieces of paper, where here's a piece of paper, you know, Jennifer, on the top of that paper are the things you can expect from me, and you can read them when you get home. On the bottom of that page, Jennifer, are the things I expect from my patients. And I'm intentional about that too. So on that bottom of the page, there's 2 or 3 things. You know, if you need to Oh no, I've got 3 things on the bottom of that page, and I hardly ever read it anymore, but they are these 3 things. I request that you do not cancel appointments. I just tell them. I don't tell them, it's written down. I request you do not cancel appointments. If it's important enough to reserve my time, then it's important enough to keep. Okay, so that's a pretty good verbal skill. The second verbal skill is, if I can remember these, you're going to be seen on time. I respect your time. My time is valuable. I do not want you to waste my time. So that's the agreement for them to show up on time. If your appointment's at 10 o'clock, you're going to be seen at 10 o'clock, not 10 or 10:15, 10 o'clock. And the third one is, I expect you to pay your dental bills promptly and in full. Now, those things are written down. Now, they're re-emphasized at the front desk also, but there's no written down sign at the bottom, give me some post-dated checks. You know, we don't go through all of that for everybody, only on specific needs. But yes, that agreement is definitely an agreement. And that's just a whole section of the new patient grid that we teach.
And I like the reciprocal nature of it. It's like, I'm not expecting anything more from you than you're expecting from me, or that you can expect from me. And it also doesn't mean that you're going to be inflexible. If somebody should show up late once the first time, well, they're going to feel bad already because they agreed to this.
Exactly.
And obviously,
exactly.
Right. And if it's consistently done, see, we don't want to make policy on the exception, you know, and some people will do this. The policy is there to be enforced within reason, but with flexibility. If somebody consistently does not keep their agreement, then you have a different conversation. But when you tell someone to, you know, show up on time or ask them to, you explain why. It's not just out of respect for my time, but we have other patients as well. And we know that you don't want to be kept waiting, and I commit to not keep you waiting. And the way we do that is by everybody respecting everybody else's time.
Yeah, and so what you just said, all those 14 sentences, I don't want to say those things. So I'm very intentional in my verbal skills. I just say, you know, I expect you to be on time for your appointment, you know, and I expect you to pay promptly and in full, you know. Any questions with that? Is that, you know, so.
Right. You don't want to filibuster. You don't want to do a monologue. I'm just sort of giving the background where you state it, and that's where the silence comes in. End the conversation. You make a simple
end of
statement.
Conversation. That rationalization that you just went to is absolutely reinforces the reason to do this. so I understand. Yes.
I get you. Okay. Next question. I like how this avoids selling the case at presentation. That was just a comment, which is nice.
Okay.
All right. The next question is, and this is going to be the last question we have time for, and that is, do you have this conversation with the patient in a consult room or in an operatory?
I have right now. I have it in the consult. I mean, in my operatory. I have a regular armchair kind of chair in my operatory. I like them in the operatory because I want them to get comfortable with us being friendly in the operatory. I don't specific, and this is intentional also. I've had I moved my office 3 years ago. I built a new office, but in my other office I had a consultation room where it was just chairs and desks and computer kind of thing, very comfortable. And I'd go in there and talk, and you could show them things on the monitor, and you could have a little flip chart if you wanted to. And I stopped that a long time ago. I stopped flip charts and monitor stuff a long time ago. It says they have to trust me. At some point in time, yes, you can take a look at the monitor and get more information and more education, but trust has to be built first. So I do it in the operatory because I want them to feel comfortable in the operatory. If we did it in the consult room and then moved to the operatory, all of a sudden those fears can come back about, oh, my dentist, what are those things over there? I want them to feel comfortable in a conversation that is fun, you know, engaging, intimate, and I do it in the operatory for that reason.
Got it. Yep, you got to be comfortable in the environment where the action is going to happen. I see that.
Yeah.
All right. Well, that's all we have time, except to thank you very much for another spectacular presentation, Peter. I knew you wouldn't let me down. You never have.
Well, appreciate you having me, and I want to thank Dental Herb Company also, because we work very well with Dental Herb Company. If the guys who are working with them, they know Tyler and Greg at Dental Herb. They bend over backwards to make everything right, and I want to thank you guys for having us all on tonight. Appreciate it.
Yep. Me too, and I've enjoyed working with Greg and Tyler also. Have known them for quite some time too. They're solid people with solid products. In a few days, you will receive an email with instructions on how to apply to receive your CE credit. I see some people asked about that. Owing to the fact that I will be out of the country for much of October and November, I invite you to please mark your calendars for our next webcast, which will not be until Wednesday, December 14th at 6:30 p.m. Central Time, when my next very special guest will be my friend, first president and founding father of the American Academy for Oral Systemic Health, Dr. Chris Kammer, who will deliver the aptly titled Make the Oral Systemic Connection Today, the simple step-by-step process to profitably incorporate oral systemics into your practice. Until then, this is Danny Bobrow wishing you a pleasant fall season and thanking you as always for your continued commitment to practice perfection. Goodbye, everybody.